I want to show you how I manipulate the image in Carestream's 3D imaging software. This is a scan with the three orthogonal planes displayed. As I said, you need to evaluate all the data on your scan. So this is a small field of view, and so the advantage is that there is less anatomy and pathology to evaluate. So the first thing I do is scroll up and down all the way through the axial slice. The slices are color coded. You see that the orangish yellow up here corresponds to the orangish yellow plane on the 3D portion of the image. And the way you manipulate that is to you can either scroll through it with your mouse wheel, or when the cursor goes over the semicircle in the corresponding color and you hold the left mouse button down, you can then slide up and down viewing all of the planes. This is the width of the plane. You can thicken the slices. You can change from average to MIP. Sometimes that cuts the noise down a little bit. And you can also view it in different configurations, multiple planes. So again, the first thing you're going to do is go over all of the slices to see if there's anything that looks untoward. So do you notice anything initially? Yeah, there's this big cyst here. So just because there's a cyst there, we need to know what it is. And just because the patient has one problem, we can't just focus in on that problem. We need to look at the sinuses, the bone, the teeth, and other parts of the scan. Here is the coronal slice. Again, it's color coded, so I'm going to move the green plane back and forth to see what I can see. Now, as you can tell from this, when I get over into this part, that not really all that meaningful. And the reason is that the arch is curved. So fortunately, we have what's called a curved slice. Here's one that's already there. I will scroll through it a little bit here to see what it looks like. And so we can see a root canal here. And then the nice thing about this one, since the slice is curved, we can alter the angle of this slice, and then we can move it around the curve. So if you will watch this blue line, as I move it back and forth, you see how that slice follows the curve all the way around the arch. And so what you're looking at when you do that is this window. And so now we're going to go all the way around the arch and look at all the data. Look at the sinuses, the teeth, look at the cortical plate. And then once we get to this region of interest, then we'll focus in on that. Everything else looks pretty good. But now that we've found this pathology, we're going to, again, focus in on that. So I align the long axis of the slice with the tooth in question. So we see that the apex of that tooth is in the slice. So we'll need to use our clinical data, our symptoms and pulp tests to see if that tooth is responsible for this large cystic lesion, or is it something else? Is it a nasopalatine duct cyst? Here's the nasopalatine duct, and it does not appear, the cyst does not, well, maybe it is. Look at there. So when you go through the slices, you see that it is contiguous with the nasopalatine duct.